With a phased approach to relaxing COVID-19 restrictions, some lockdown conditions are likely to remain. This has detrimental consequences for women living with their abusers. Often they are denied access to using telephones to report.
He said he would kill me, remove my eyes, dump my body where they wouldn't find me, and would then go to my family, knowing full well what he did with my body.
This 33-year-old says she was terrorized for 5 years. She was unable to break free from the abuse. The violence worsened during the lockdown. Her movements were restricted and she was barred from using a phone. Last Wednesday, she managed to manipulate her way out of the abusive situation. She fled with a 5-year-old daughter, but her 2-year-old is still in the man's care.
I left to take the Sam to my aunt. After dropping it off, I went to a friend and told her about my situation. I then used her cell phone to dial the number for GBV assistance I got from a radio show which highlights abuse.
The mother has sought refuge at this shelter. 1 in 3 women are victims. Mass screening and testing in communities is opening a door of opportunity.
If we started thinking in a team approach that was combining mental health with counsellors from organisations who specialise in domestic violence, and they were going out en masse with the testers, I think that's another way to reach people on the ground. I think the priority is to think about policing domestic violence in a lockdown in a way that is compassionate. It's about how do we create teams to go out, work with community health work testers to provide mental health care and other kinds of support.
There are also more pragmatic interventions.
For children in distress, giving each child a whistle. If they hear a whistle blowing, literally and figuratively, meaning that a child is in distress, and having a street leader identifying somebody that people can go to in times of grave need and distress or needing to be rescued. Another option was to have a siren at strategic points in the neighborhood, more than one point, having several points, so people are aware that they could actually reach out.
Practical interventions like these could throw many vulnerable women and children a lifeline. Gillian Pillay, SABC News, Lenasia.